Hi. So I was talking to, well, it happens quite a lot. I was talking to a patient about a scan result, so an MRI scan result for their back pain. And we were talking about why we don't MRI scan for back pain as a general rule. There are always going to be exceptions to that rule, and your health professional will share it. If they think you need a scan, you will get one. But I wanted to sort of share why we don't do it generally for back pain, and certainly we scan a lot less than we ever used to do, because I've been doing this like 25 years now. I know when I first started we used to do a lot more scanning, x-raying, investigations. So I understand why, it can be worrying when someone says, but I've got pain, it's not gone away, I've tried this, that, the other, and it's not any better, why aren't you scanning me? Well, first of all, MRI scans only show a picture of your tissues while you're laid down. They cannot possibly tell you where pain is coming from. And also, if your pain, which most people's pain is when you're moving around or when you're active, then lying down on your back doesn't represent what your tissues look like when you're moving or when gravity's acting upon you. So that's one of the big limitations of it, is that the fact it's a static picture of you lying down, but it doesn't tell you anything. It's just a photograph of your tissues. Now, the other thing I wanted to show you, now I'm going to be very clever now and try and share my screen so that you can see. Right, we don't need that little bit there. See, I'm not professional at this. This is a study that's been done that looked at patients who are asymptomatic, which simply means they do not have any symptoms, to look at this to see whether scans are telling us what we want to know. Discs, excuse the spelling, it depends which country you're in, but disc degeneration, degenerative discs, are quoted a lot in scan results. And I get that it's quite scary thinking, well, my discs are degenerative and I've got back pain. So therefore, what we're trying to do is we're trying to think pain. Oh, there must be something on the scan. Oh, the scan shows me I've got disc degeneration. Well, look at this. At 50 years old, 80% of people who were scanned who didn't have any symptoms had disc degeneration on a report. That is incredible, isn't it? 80% of people who were scanned with no back pain went in, and when the radiologist looked at it and did a report, 80% of 50-year-olds had degenerative changes, degenerative discs. 68% of 40-year-olds and 88% of 60. Okay. Next thing we talk about is disc bulge, which I did in the other video that I've recorded. For a disc bulge, when you're 50, 60% of us, and that includes me, have got disc bulges. It's a fact. It's something you will see on a scan, but they haven't got back pain. 69% when you get to 60, which is still young. Even 50% of 40-year-olds, 50% of 40-year-olds that get scanned have got disc bulges. Another one that I hear a lot, so I picked the three that I see a lot. I haven't underlined this one, but facet joint degeneration, right? So that is the bit that I showed you on my other video. Okay. Oh, she says, have any pull off. I'll just send this together. Okay. That's the bit of the spine. Oh God, I've managed to. I think I managed to break it. Yeah. No, I haven't. Professional, hey. So that is the bit of the spine where one of the joints here meets the other joint. Can you see I've got my finger between it? That's your facet joint. So, and they're both sides of your spine. That 32%, you'll see that in 50-year-olds. It goes up to a 50% of us when we're 60, and nearly 70% when you're 70. So again, it's significant increase as you get older. Now, 50 isn't old. I speak with experience, 50 isn't old. But look at that. Look at the changes that we're seeing on a scan with people who do not have back pain. Right, I'm going to stop sharing and come back to it. Oh, how clever is that? I'm quite impressed with myself. So, whilst I know that back pain's really bad and I've had it, and there's so much we can do, this particular video is just to share with you how much you can see with someone who hasn't got back pain on a scan. That means that if you do have back pain and you get scanned and you see that changes, it might not be relevant to your back pain. Does that make sense? So you might somehow end up having a scan and it shows all of that, and then your health professional says it's quite normal. But you read the report and you say, that's not normal. But hopefully with those statistics, that research, it will show you that that's what we'd expect to see anyway. But it isn't just your scan results. We, particularly physios, are listening to how it impacts you on day to day. And we need to take where you have pain, how it behaves. So what makes it better and what makes it worse? Is it worse at night and during the day? We take all of those into consideration. What you try and take, maybe pain relief, we take all of that consideration and think, does it fit with what I'm seeing on a scan? Is it relevant? So it's good that you have a normal scan. And so if you see that and you read a report, because I get it all the time, because a lot of people have got access to their health records now, you can see it and you think, well, why hasn't anyone flagged that up? That's why. Okay, do not think you've got that and you've tried physio or you've tried painkillers, whatever, and you've got that on the scan. There's nothing more you could do, because that's a whole other long video for me to record. There's so much more you can do. And what I'm going to try and do is, but I'm going to record a series of videos around pain and why we experience pain. But I thought this was a really good place to start. And I hope you found it interesting. So don't give up if that's your scan, and don't think all is lost. Okay. Thank you for watching, and I'll see you soon.